Hi, this is Joe Zaza with ASD Management, and today we're going to discuss pre-development of surgery centers and really the history of surgery centers. I think it's really important to kind of remember where we came from to realize where we are today and how to make these successful today. The first surgery center was 1970 in Phoenix, Arizona. Right now, we estimate there's about 6,300 surgery centers throughout the United States. Many of them are single specialty centers, but we have several multi-specialty centers. Now, my company, we primarily do larger physician hospital joint ventures, but these started, again, as I said, in 1970 with a plastic surgeon by the name of Wally Reed. And Wally was way ahead of his time, and we saw growth from 1970 to about 1980 of small growth in the surgery center business. And then in 1980 or 1981, something happened, and that was significant. Medicare allowed ambulatory surgery centers to be part of the Medicare system. And what they did was they said, what we're going to do is we're going to pay for these surgery centers now, but instead of paying like a hospital, and a hospital at the time was paid, a portion of it was their cost, and a portion of their fee was based on a facility fee. They just said, surgery centers, you're going to have every CPT code put into one of 8 categories, and we're going to pay you a flat fee, regardless of your cost. And what that did was it really facilitated efficiency in surgery center operations. And to this day, Medicare still pays us a flat fee with certain exceptions, but generally a flat fee for all ambulatory surgery procedures regardless of cost, which makes us have to be more efficient. And on the other side, quality of care must still remain there, or we're not going to be able to attract patients. And the data supports that ambulatory surgery centers are very efficient, but also very high quality facilities. So going back to the early 70s, we saw small growth in the industry. In the 80s, we also, apart from Medicare, we also saw cataract surgery and the phacoemulsifier units really take off, and we saw a huge growth in the 80s in ASCs. And then there was a wave in the 90s, primarily with laparoscopic surgery, and we saw anesthesia advances. And then today, now we're doing a lot of cardio procedures in surgery centers, which I would never have guessed when I started in the business in the early 90s would ever be done in surgery centers. And then the strong growth market today is in joints, total knee repairs, total hip repairs, and total shoulders. So we've seen technology and the surgery center industry grow congruently together. One of the other key concepts to talk about is that an ambulatory surgery center, and this is just kind of some baseline things to know, is essentially a fixed cost business. So you pay for the building, you pay for the land, you pay for the equipment, whether you do 10 cases a month or 300 cases a month. So it's extraordinarily important when you're planning a surgery center to have enough cases on hand that you project that are going to be done there. And if somebody says, I do 100 cases, I would not project that. I project about 60, 70 cases to be done at the surgery center so that you've given yourself enough room in your projections. And we're going to go through in the second section exactly how to do financial projections. One of the other things we want to talk about are the strategic planning elements involved in a surgery center, and how and why are these developed? And there's a couple of reasons. First of all, physicians have a strong interest in independence and control. And this is one of the few things surgeons can invest in themselves and still have an economic interest in it. And there's laws that form around our industry that make sure that we have appropriate arrangements. Patient care and physician patient satisfaction is very high in ASCs. And hospitals in particular are now really even more so embracing ambulatory surgery centers because of the way they're reimbursed. As I said earlier, Medicare reimburses us based on a fixed fee and not based on cost. But we're also paid approximately, ASCs are paid approximately 53% of what a hospital is paid for the same case. This drives efficiency towards surgery centers, and managed care payers want to see certain kinds of procedures done at surgery centers. Hospitals have embraced that and understand that they can use this as a strategic tool for them to not only move cases to those centers, but also use that in their negotiations for their inpatient rates. They also can use a hub and spoke strategy with ambulatory surgery centers to affiliate with surgeons that may not be in their network and create more business for the hospital itself. So the economic drivers of surgery centers are the way they're reimbursed and the fact that they're reimbursed on a fixed fee basis, and payers are really pushing to see things like tubes and tonsils on the ENT side, or knee arthroscopy on the orthopedic side. And the list goes down the line of things that they want to see being done in a surgery center and not pay twice as much in a hospital. Gastro procedures would be a very common thing you're going to see in an ASC. The last thing I'd like to touch on is the types of surgery centers. An ambulatory surgery center is a specific entity. It is a specific licensed entity that is very different than a hospital outpatient unit. A hospital can have an outpatient department, but that is going to be part of the hospital, and it's going to be reimbursed differently, generally twice as much as what a surgery center is for the same procedure. An ambulatory surgery center, on the other hand, typically is a for-profit entity. It may be owned 100% by physicians. It may be owned 100% by a hospital, or more commonly, it is a joint venture between the physicians and the hospital. Those are, from our experience, the most successful centers when there is a true partnership with the hospital. So those are the kinds of outpatient centers you see. Remember, an outpatient unit at a hospital might be part of the hospital. It might be reimbursed at the hospital rates. And a surgery center, an ambulatory surgery center, is its own designated, has its own designated license. And the distinction is that an ASC can only do patients up to 23 hours and 59 minutes, meaning that they cannot stay overnight. Now, they can stay overnight technically, but they have to be discharged within 23 hours and 59 minutes. So I hope this gives you a good overview of the history of surgery centers, kind of where we are today, and sort of how they operate going forward, and what we're going to see from a growth standpoint. Thank you.